Hey guys, I hope everybody had a good weekend. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. We are going to go over shoulder mobility exercises. So always a good idea to check in and see how your joints are moving. Unfortunately, when we lose range of motion, it's not something that happens overnight. It's not a quick loss of range of motion. What happens is you just start using your arm a little bit less or your leg a little bit less, and over time the capsule actually just starts to kind of freeze up a little bit and you stop being able to lift your arm all the way up overhead. It just starts to get lower and lower and lower until one day it seems like all of a sudden you aren't able to lift it up over your head, but in fact that actually took a long time for that to be compressed. So we want to talk about some shoulder mobility exercises because I get asked this question a lot on the pool deck and in the clinic. So it's something that's really important. It's something that you want to maintain throughout your life, and it can prevent rotator cuff tears. That's right, I said prevent. Having a healthy shoulder range of motion, having healthy shoulder strength will actually prevent rotator cuff tears. So I know that's a big scary thing for people to talk about and big scary thing for it to happen because it can lead to surgery. So we want to talk about how we keep that shoulder healthy and how we keep it moving. So one of the first things I always talk about with shoulder mobility is you want to make sure that you are doing anything that you are, anytime you're moving your arm, you want to make sure you're doing it in front of a mirror, because a lot of times, especially if you're experiencing shoulder pain, you have a tendency to do this. Now, that's a gross exaggeration of what you may do. It may be very subtle, but what happens is a lot of times this is the compensation for range of motion. And instead of actually you having full range of motion, you end up having more shoulder shrugging than you do actual range of motion. So anytime you go to start moving that arm, and simply just moving your arm up overhead like this is a good way to start with shoulder mobility. A lot of people take that for granted and think that's too simple, but it's something that you want to start by doing, just watching in the mirror, thumb up, and just lift that arm overhead. Make sure it's a nice pure movement. You're not, again, lifting that shoulder, whether it be out to the side, but watch yourself in the mirror. It is very common, and you don't know you're doing it because it's a compensation strategy. So it's just something that you'll automatically do and not realize that you're doing it. So make sure that anytime you're moving that arm, it's just simply up and down, nice and slow. You can go out to the side, just working on that shoulder mobility. Couple of exercises we're going to go through. I'm going to take this is a beastie ball. It's got very large spikes on it. It is intense, so if you are very sore, you might want to start with a tennis ball, something not as spiky. But if you really want to get in there, this is what you want to do. I'm going to show you two spots that you want to mobilize. So this is for back here. So I would start with more of a wall instead of on the table like I'm going to show you. So if you stand up against the wall and you push on this, that's a little bit gentler than what I'm about to show you. But what you can do is just put this right underneath that muscle and you can push on it. Now, obviously your shoulder blade's right there. You don't want to put this on your shoulder blade, not like you're going to hurt yourself, but it's very painful and you don't want to do it. So you want to avoid your shoulder blade, but you want to start up here on this muscle, and then you want to go below your shoulder blade. So take this and go actually below your shoulder blade. And you want to move it all around. Oh, there's a good one. Especially as you find these knots. So when you find a spot that's really sore, like I'm on right now, you want to hold that just for a couple seconds. And again, if you can't tolerate this laying down, just stand up and do it up against the wall. But breaking up this muscle tissue, and I'm going to show you right in here, all right back in here. So above the shoulder blade and then below the shoulder blade is going to help with that shoulder mobility. And the next thing I'm going to show you is just a simple stretch that you can do is you want to lay on your shoulder just like this and have it up at 90 degrees. Now, if you roll off your shoulder, this becomes a completely different stretch and it becomes really, really easy. So this is when you're doing it wrong and you're not actually laying on your shoulder. You want your shoulder right underneath you, and then what you're going to do is you're going to let that arm fall, and then you're going to gently push. Don't jam it down. You can overstretch and really hurt yourself, but this is more typical of what this looks like. Being an ex-swimmer, I have very impaired shoulder mobility, so it's very hard for me to get down to the table, but it should look like this, but more in this position. So some of you may be able to gently push this down all the way to the table. You want to hold this 30 seconds and you want to do this 6 times. just to help loosen up some of that shoulder area. And the final thing I'm going to show you is just a simple, what we call pec stretch. So just the front of your shoulder. So you just want to put your arm up above, hold there, and then just start turning your body. Okay, you're going to feel a stretch across here. You can also do this in the doorway with both hands, but you want to feel that stretch across the front of your chest. Again, that's going to open up all of this front of your shoulder and make sure that you're able to use that shoulder joint appropriately. With us sitting in these postures all day long, we wind up really being tight, and that having that tightness will impede that shoulder mobility. If you or someone you know is suffering with shoulder pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.